Hello A&P students, this is Mr. Becker here to talk about the blood vessels of the body circulation. All right, so these are the blood vessels that we find in the neck and thorax. All right, so I'm going to start from right here. This is the ascending aorta, and then we have the arch of the aorta. There's three blood vessels that come off of the arch of the aorta: the brachiocephalic trunk, the left common carotid, and the left subclavian artery. Right. Sitting next to the aorta, we have the superior vena cava here, and we have a slightly different organization. Remember, we have the left brachiocephalic vein, the right brachiocephalic vein, when we only have a singular brachiocephalic trunk. All right, so from there, the brachiocephalic trunk, shown behind here, branches to form the right common carotid, which goes up the neck here, and the right subclavian artery, which you can see shown right there. Back it out a little bit. All right, so next to that is the right subclavian vein, and then next to that would be the right internal jugular. Over here we can see the same thing. We have the left brachiocephalic vein, which is going to be draining blood from the left internal jugular, and the left subclavian vein being shown right here. All right, so if we then take a look at some of our other models, all right, so over here, all right, we can see our purple guy, and I'm going to zoom in. So here we can see the left brachiocephalic vein. We can see the left internal jugular right here. And then next to that is the left external jugular vein. So this is interesting. There's no common jugular vein. The external jugular comes directly into the left subclavian. And then the left subclavian and the left internal jugular form the left brachiocephalic vein. So when you're looking for things, this is the only model that has the external jugular on it. It's being shown right there. All right, so if we then take the heart out, we can make out a set of other blood vessels along the backside that are shown pretty well here, running in the intercostal spaces, and you can see them piercing through the pleura at some point. We have the intercostal arteries and veins that are being shown here. So the intercostal arteries in red and the intercostal veins in blue. All right, so, and to show these off a little bit better for how the veins come together, we're going to go back to this model. All right, so I'm going to remove the heart and then keep the diaphragm in position for 1 second. I'm going to pull the diaphragm off. Right. And this allows for us to be able to see the inferior vena cava and the descending aorta, or the thoracic aorta, through here. And one of the things hopefully you can note about this, you can see the intercostal arteries coming off at regular intervals, and you can see the intercostal veins paralleling them in the background here as they work their way under the pleura. I'm going to remove the aorta. Actually, before I take it away, you can see that the back of the aorta has the paired intercostal artery exit points being shown on it. So that kind of shows you the segmentation of the aorta. Right, so once we do that, all right, so we can make out for ourselves the fact that there's two sets of veins here that are running up the sides. On the left side, we have the hemiazygos vein, and on the right side here, we have the Azygos vein. All right, so I'm going to kind of zoom in on it a little bit here. All right, so that way you can see the end of the Azygos vein. If I bring the heart back then, all right, so you can see the end of the Azygos vein being shown right here, right, coming into the superior vena cava from the backside. So the superior vena cava receives blood from three things. All right, the right brachiocephalic vein, the left brachiocephalic vein, and then the azygos vein on the back. Note, azygos does not have a U, right? A-Z-Y-G-O-S, not a typo. Now, the final sets of vessels that we have are on the red torso. All right, so as soon as we come through the aortal hiatus here, all right, the very first pair of blood vessels to branch off here are the inferior phrenic arteries. And then on the other side of the red torso, all right, so shown right here and right here, you can see it kind of goes underneath the transversus thoracis here. These are the internal thoracic arteries and veins. And again, this can be cited because we're looking at it from the back. Left is left and right is right.